We come to you from KwaDukuza, and right now we are standing outside one of the clinics here in KwaDukuza, which is said to be experiencing a number of challenges, and including the topical issue of medication shortages here in the province of KwaZulu-Natal. And we've just came out from a media briefing by ActionSA, which has said that they have conducted oversight visits at 3 districts in various healthcare facilities here in the province. But to speak to us more in terms of this oversight visit that ActionSA has undertaken, as well as the findings, it is the Member of Parliament of ActionSA, Dr. Lehlape. Doctor, thank you so much for joining us. Let's speak about the oversight visit that you have conducted, and what were some of your findings?
The findings are we have serious problems on the ground, severe drug shortages, severe staff shortages, challenges with ambulances, mobile clinics that are not mobile. So the problems are quite severe on the ground. And you have indifferent management that does not engage the workers, that is indifferent to the plight of the people. And we have lots of actors. Acting manager there, acting manager in the 3 hospitals that we went to. That is not acceptable.
And you have given us some of the solutions, and amongst them you did say that you are planning to write to the South African Human Rights Commission. Just elaborate more on that.
That is based on the fact that the rights of the patients are violated. Can you imagine you're an old lady, you come to a clinic and you get turned away that there are no medications for you, or some of your medications are not there, and you got to come back the next month, or in that same month go back to the hospital at the top to try and get the medication. Nobody has done the professional job of saying this medicine is not there, here's a substitute, or telling you frankly, for this year we're not going to be able to get your medication, how are we going to manage your condition? It's unprofessional the way people are treated.
Doctor, the MEC for Health here in the province of KZN, Nonjabulo, she has responded to these concerns, and she has labeled them as misinformation and exaggerated. How bad is this crisis in the province, or would you say that it is a crisis?
Oh, it is a crisis. Yesterday we were told of a young man that couldn't get a tooth extraction at the shore because there were no analgesics. And some good Samaritan had to pay 450 to take them across to a dentist to have the tooth extracted. And we were told about wards that don't have fluids in Nongoma. They are waiting to get fluids, excess fluids from other places. And when those fluids arrive, an SMS gets sent to a WhatsApp group at night to say, I've got 3 veccholitas, please order quickly. That's not how you run institutions.
Thank you so much, Doc, for your time. Well, that is Dr. Lehlape, who is the Member of Parliament for ActionSA. But let me just rope in another member of ActionSA, chairperson of ActionSA here in the province, Mr. Mntungwa-Makamu. I know that you are said to be one of the whistleblowers who has actually brought this information to the public on social media. And of course, the MEC is not happy with the information, and she has labeled it as misleading. Your response to this?
I think one must say it's unfortunate that the MEC keeps spinning this issue. We are in a crisis in KZN. We have a disaster. And what I expect from the MEC is to engage the Premier, and then they, as a cabinet, write or invite the President and the Minister of Finance and Treasurer to explain the problem we are facing. If the issue is money, because we don't even know where the money went to. And for the MEC to go around and say this misinformation again shows that the MEC is dishonest with the public and also lack transparency, because the code of conduct does specifically say that the minister or MEC must perform their duties with high level of integrity, honest and transparency. It's for that reason, as ActionSA, we believe the MEC must really deal in her own conscience and just resign, because definitely she has in breach of her own oath in terms of code of conduct, because definitely she's not being transparent, she's not being honest, and to put it bluntly, the MEC have lied to the public by saying there is no shortage. There is a shortage. In fact, there's a crisis. You can't even downplay and say it's a challenge. It's a crisis we are facing.
Thank you so much, Mncango. That is Mr. Zwakele Mncango, who is the chairperson of ActionSA here in the province of KwaZulu-Natal. And of course, they have given us some of their findings in relation to the oversight visits that they said that they have conducted at various healthcare facilities. In the media briefing, they also did raise concerns that at some of these healthcare facilities, they were denied access. But of course, they've said that they will raise that issue with the president as well as the premier of the province.